Ne saçma olur mu? Olacaksan söyle.
Hoca 15 dakika geç gelecek.
Yok yok şey bizim yer değiştirdiğinde.
Size söyledim.
Tamam ben söyledim. Şey var mı? Hocam bizim işimiz yok. Çarşıda. Ya bizim çekiyorum. Mevzu kalesine gezerken bir yere edip yazı veriyor. Evet, sen de güzel. Nerede? Adamın orada. Gitti mi sen hiç? Gerçi sen kaybettin değil mi? Geçen de ben de gidiyordum da.
Buyurun aşağıya. Olacak mısınız? Sen peki ne oldu? Ama kusura bakma. Siz de eğitim alsanız. Şey, biri poster. Genelde bakıyoruz. It's not going.
That makes sense.
Paylaşmak sevdiğiniz şey It's not said it's
I say forward, some small. Aklıma gelmemiş. Kızım yapamaz. Gel. Ha? Tamam, kime göre?
Second group, where is your presentation? Please send on the Teams. Can you use your computer?
Yes.
Okay. No problem. If you,
Hocam, I want to check the entry of
like,
Biz aynı durumda değişiyoruz.
okay, no problem. You can send your plan.
Ben yürü verdim. Gerçekten zor. Böyle çok yasak böyle. Ama bu şey daha iyi. Yani yani. No. Yes, yani.
Guys, zor, first, yok. Bu ikinci sınıf ama şey oldu. Üçüncü sınıf. Okey. Başlayabiliriz. Boş kağıdı olan var mı? We have olacağı geliyor. Bir de kalemini de ver. Ha,
Ekstra değil mi?
ekstra puan. Kalem verirsen.
My extra points hocam.
Okay. Başlayabilirsin.
Good morning, hello everyone. Today my group and I will be presenting on breast cancer. This is a very important topic because breast cancer is one of the most common cancer worldwide, affecting millions of people every year. Before we begin, I would like to introduce our team members. My name is Batuhan.
My name is Burak. My name is Olcan.
First, we will discuss the aim and objectives of our presentation. Then we will explain introduction, aim and objectives, types and signs and symptoms, risk factors and prevention, complication, pathophysiology, diagnosis, treatment and management, nursing care and nursing diagnosis, nursing education, and summary and quiz. Aim. The aim of this presentation is to provide a comprehensive understanding of breast cancer, including its types, signs, and symptoms, risk factors, complications, and management. By exploring the pathophysiology, diagnostic methods, treatment options, and nursing care strategies, we seek to change awareness and promote early detection through self-examination education. To achieve our aim, we have outlined the following objectives. To provide an overview of breast cancer, including its types and characteristics. To identify common signs, symptoms, and risk factors associated with breast cancer. To explain the complication, pathophysiology, and progression of the disease. To discuss diagnostic methods and available treatment options. To highlight the role of the nursing care in managing breast cancer patients. To educate on breast self-examination as a tool for early detection. Breast cancer. Breast cancer is a type of cancer that originates in the cells of the breast, primarily affecting women, though it can also occur in men. It's one of the most common types of cancer worldwide and can develop in various forms, ranging from non-invasive to invasive types. Breast cancer is characterized by abnormal cell growth that might form a lump or mass, and it can spread to other parts of the body if not detected and treated early. Recognize the early signs and symptoms of breast cancer is crucial for early detection and treatment. Most common signs and symptoms: lump in breast, skin change, pain in breast or nipple area, change in breast shapes or size, nipple change, and swelling, lumps or underarm. There are several types of breast cancer, but we will focus on the most common ones. Ductal carcinoma is a non-invasive form of breast cancer where abnormal cells are found in the milk ducts but have not spread to surrounding tissue. It's considered the early stage of breast cancer. Invasive ductal carcinoma, the most common types of breast cancer, IBC, deep bleeding in the milk ducts and then inmates surrounding tissue. It gets spread to other parts of the body through the bloodstream on lymphatic system. Invasive lobar carcinoma. It starts in the mid-thoracic lobes and then spreads to surrounding tissue. It's the second most common form of invasive breast cancer. Inflammatory breast cancer. A rare and aggressive form of breast cancer that causes the breast to become red, swollen, and warm, often without the distinct lump. It typically spreads quickly. Triple negative breast cancer, a type of breast cancer that doesn't have estrogen receptors, progesterone receptors, or excess HER2 protein. It tends to be more aggressive and harder to treat, but is more common in younger women and women with a genetic predisposition.
For risk factors, risk factors divided into modifiable risk factors and unmodifiable risk factors. The risk factors, one is like gender. Women are more likely to develop breast cancer than men. Second one is age. The risk increase with age, especially after 50. Family history, close relatives such as mother or sister with breast cancer increase the risk. Genetic mutation, inherent genetic mutation like BRCA1 and BRCA2 significantly increase the risk. Personal history, having had breast cancer or certain non-cancerous breast condition, increase the likelihood of developing it again. Hormone, long-term use of combined estrogen or and progesterone therapy may elevate the risk. And lifestyle factors, smoking, excessive alcohol consumption, diet high in fat, and lack of physical activity contribute to higher risk. Some of these risk factors beyond the personal. For prevention, there is a lot of prevention method, but I'm gonna explain the most common ones. Regular screening, early detection through mammograms and breast exams, healthy lifestyle, maintaining a healthy weight, regular exercise, limiting alcohol, and avoiding smoking. Breastfeeding for an extended period can slightly reduce the risk of developing breast cancer. Prophylactic surgery for those with a high genetic risk, preventive mastectomy or oophorectomy may be considered. Medication for high-risk individuals, medication like tamoxifen and aromatase inhibitors may help lower the risk. Limit hormone therapy, avoiding long-term use of combined hormone replacement, and genetic counseling. Individuals with a family history of breast cancer may benefit from genetic counseling and testing to understand their risk. One of the most important takeaways is the prevention start with awareness. For complication,
Olacak. Prophylactic surgical approach is for patients who have person, not patient, who have carried BRCA1 without cancer, okay? Without, before the diagnosis, this operation done, okay? Is it all done? Yani ailede genetik faktör var ama kişi hala kanserdeyken yapılıyor. And do you know Angelina Jolie? Yes. She's a famous artist. And she has bir şey geriye gelsene. BRCA1 gene. She carried this gene because for her family history. And then without cancer treatment, she preferred prophylactic surgery. Surgeon remove her breast, both breasts, and they put implant inside of the breast tissues. Okay, this is like these operations. Without cancer, but patient who have a great risk prefer prophylactic surgery.
So it's like prevention.
Yes, it is a prevention. Yes.
Okay.
But this patient have more than 70% cancers. Okay. Or some patients prefer oophorectomy too. Okay.
Okay.
They remove their
Ovary.
ovaries too.
Hoca, if the patient has cancer, also can do that surgery?
Yes, but we cannot say it is a prophylactic surgery because already it is a patient. It changed to treatment. But this is a prophylactic surgery. Like, isn't a vaccine, but the idea works like a vaccine, okay? If you haven't got a breast, you cannot be a breast cancer. The idea is this, okay?
breast cancer can lead to complication. One is the metastasis. If breast cancer spreads to other parts of the body, it becomes harder to treat and may lead to more severe health issues. Second one is lymphoma. This occurs when lymph nodes are removed or damaged during surgery or radiation therapy. Reassurance. Breast cancer may return after initial treatment, either in the same breast or elsewhere in the body. Infection. Surgery or chemotherapy can weaken the immune system, increasing the risk of the infection, particularly after mastectomy or other surgical procedures. Some women experience ongoing pain or discomfort after surgery, radiation, or chemotherapy, which can affect their quality of life. And cardiovascular issue, certain breast cancer treatments like chemotherapy and target therapies may increase the risk of the heart problems. Hormone therapy and chemotherapy can weaken bones, increasing the risk of osteoporosis and fractures. And treatment side effect, chemotherapy, radiation, and surgery can have various side effects, including fatigue, hair loss, and gastrointestinal issue. Also, breast cancer can lead to some emotional effect. For pathophysiology, pathophysiology of breast cancer involves the abnormal growth and division of the breast cells, leading the formation of a tumor. This uncontrolled cell division occurs due to genetic mutation that affect the normal regulatory mechanism of the cell cycle. Apoptosis is main programmed cell death, and DNA repair. Cellular mutation, genetic mutation in specific genes such as BRCA1, BRCA2 can disrupt the normal cell growth cycle. Mutation in the oncogenes promote excessive cell growth, while mutation in tumor suppressor genes prevent the repair of damaged DNA, leading to cancer. Dysregulated cell growth, when this mutation accumulates in breast tissue, they cause cells dividing uncontrollably. This uncontrolled growth leads to formation of a mass of tumor, which can be non-cancerous or cancerous. Angiogenesis, as a tumor growth, it needs a blood supply continuing growing. It stimulates the formation of new blood vessel, a process called angiogenesis to provide oxygen and nutrition to the growing tumor. Invasion and metastasis. Malignant cells have ability to invade surrounding tissue and spread to other parts of the body. These cells break free from the primary tumor, enter the lymphatic or bloodstream, and establish secondary tumors in distant organs like bones, liver, lungs, and brain. Understanding the pathophysiology of breast cancer is crucial for developing target therapies, such as hormonal therapy, chemotherapy, and immunotherapy, which works by distributing specific stage of tumor development and spread. And there is a diagnosis. Healthcare provided manually examine the breast organs, change in size, shape, or texture. For mammography, mammography is specific X-ray image of the breast used to detect tumors and abnormal areas. They are the most common screening tool for early detection of breast cancer, especially for women over 40 of those with risk factors. Program is ultrasound. Ultrasound use sound waves to create image of the inside of the breast. It is often used to evaluate the suspicious area detected by a mammogram or cycle exam. It helps to determine whether the album is solid or filled with fluid, is mean kystic. And biopsy, there are different types of biopsy. Biopsy is a definitive test for diagnosing breast cancer. A sample tissue is removed from the suspicious area. One is the needle biopsy, second one is surgical biopsy. For the treatment part, treatment depends on cancer type, stage, and patient factors. One treatment method is surgery. Lumpectomy, removal of the tumor and surrounding tissue, preserving the breast. Mastectomy is removal one or both breasts, typical for larger or more invasive tumors. Radiation therapy uses high energy rays to kill remaining cancer cells after surgery, particularly for women who undergo lumpectomy. And there is another treatment method: immunotherapy, target therapy, hormone therapy, biological therapy, and supportive care. And no single treatment works for everyone.
And I will continue. Before starting, I will ask some question. Up to the here, we get many information. How about how can we get nursing care on breast cancer patients? Do you have any idea?
Like what is the nursing diagnosis?
No, nursing care.
Nursing care.
How can we get nursing care?
I mean, before surgery or after surgery?
It doesn't matter.
After surgery, it is important the risk of infection,
Mhm.
preventing the risk of infection.
And before that would be like the person might say factors,
Mhm.
age, lifestyle.
That is right. First, we can talk about the before surgical operation
Mhm.
or during the screening program. Okay, let's start with the screening program. What is duty of a nurse in screening program?
I feel like they should teach about how to detect breast cancer is important. Like when they take their after menstruation, when taking their bath, they can raise their hand, look at the mirror, and check for any lump in the breast.
We teach self breast examination.
Yes, breast examination.
Females.
Yes,
Also to male too,
yes.
because breast cancer is a risk for male too.
Mm.
Okay. Başka? Taramalarla ilgili. Introduction say about the screening program.
Okay.
Ne olabilir başka? Tarama programlarına söz edecek misin?
Tamam, programı
Aha.
söyledim.
Olur. Tamam. Yani sadece bununla kalacak şeyler vermeyeceksiniz. Tarama programları nedir? What is screening program, guys? YouTube, public health nursing.
Mhm.
Also, we mentioned about screening program in gynecology.
Measure.
It's really good to check everyone in the house.
Actually, I asked, what is screening?
Screening program is like creating awareness. We are looking for community or going from houses to houses to target people and to give the education, patient education, creating awareness to people. And also celebrating maybe Cancer Day, something like that. To
Right.
create awareness.
Education is part of
Yes.
screening program.
Mm.
Yes. Or the any slots.
Look at the patients and the fact.
As part of. How can we detect these factors?
Family history.
Taking family history,
Mhm.
And
genetics,
Mhm.
and screening
Mhm.
programs like some special people who have a family
History. Yeah.
And I see 1 and 2
Mm.
is free of charge
Yeah.
in many countries. But dear friends, this is only for the patient who have a great risk.
Mm.
On the other hand, mammography.
Mm.
Pap smear test for the HPV, right? For
Mm.
cervical screening. They are free of charge and with or without having a history about a cancer after an age, for example, for the HPF after 30 years old or 3 years after first sexual intercourse, every woman attends the screening programs until the 65 years old. Of course, this amount and years change country to country because the prevalence of the cancer or a specific problem change country to country, right? Because of rice, because of the economical burden, because of the healthcare systems power, the screening programs, of course, is generally places. Okay? Yani tarama programlarında hasta olmak zorunda değilsiniz. Hastalık riski evet belirlemek için kullanılıyor. Also some countries, for example, in Turkey, we have a screening program about hemophilia, right? Before the marriage, every candidate couples go to a healthcare center and gives blood example for hemophilia, for şeyin adı neydi? SMA, multiple sclerosis, Akdeniz ateşinin adı? Akdeniz ateşinin adı nedir arkadaşlar? Akdeniz anemisinin adı.
Anemia direkt.
Evet.
FMF.
İşte onun açılımı var.
Familial Mediterranean.
Familiar Mediterranean anemia. Do you know? It is very common in Africa, in Mediterranean countries such as Spain, Italy, some coast of the France. It's very common. Also, Turkey is a kind of Mediterranean countries, especially in Akdeniz, around the Ege. Okay, we see these diseases. So it is my countries have a program about for this detection Mediterranean anemia. Okay, I am sure there is
Yes.
some special screening program in your country too, dear friends. Okay, yes, shortly screening programs detect everyone in a country. But of course, it's changed gender to gender. For example, men don't need HPV or pap smear test, right? Okay, it is a disease-specific programs, and they should be free of charge, and they have to serve the country's health programs. And generally, World Health Organization donate many budget money to countries to create their national screening program. Because always early detection or prevention is cost effective than treatment. Okay. So in breast cancer, for cervical cancer, screening program, dear friends, always cover the disease which can be detected. For example, we can not mention about the intestinal system cancer. Okay, we cannot mention about screening program about the intestinal system because there isn't a certain diagnosis technique about it. Okay, but for cervical cancer, only pap smear can work. Okay. In gynecology, in the obstetrics, please remember we mentioned about the some tests during the pregnancy for Down syndrome. Maybe you all remember. In Turkey, we say ikili test, üçlü test, amniocentesis. For example, after 36 years old, each woman, each pregnant woman can get free of charge amniocentesis in Turkey and in many countries because it is a kind of screening program. Because women who have older than 36 years old have a great risk about the Down syndrome, right? And the other abnormalities related to the fetus. So government have to provide this screening program then, okay? Is it open now? And nurse have a great importance in the screening program because many tests, education, recording this system, and doing statistic, taking data analysis are and nurses responsibilities here. Yes, okay. Evet, hadi devam edelim.
Nursing, firstly, assessment. Monitor the patient physical condition, including vital signs, wound healing, and any side effects from treatment. Assess the emotional and psychological well-being, addressing anxiety, depression, or body image concern. Secondly, pain management. Provide pain relief through prescribed medications and alternative therapies. Educate the patient on pain management strategy. Post-operative care. After surgery, ensure proper wound care, monitor for sign of infection, and educate on the post-surgical restrictions. Encourage deep breathing and early mobilization to prevent complication like anemia or blood clot. And lymphedema prevention, we take on the importance of avoiding injury to the affected arm to reduce risk of lymphemia, provide exercise to improve arm mobility and reduce swelling, psychological support, offer emotional support to help patient cope with the diagnosis and treatment, addressing issues related to self-esteem, body image, and fear of recurrence, provide information about support groups and counseling service, monitoring for complication, monitor for sign of complications such as infection, deep vein thrombosis, or metastatic spread, regularly assess the patient response to treatment and adjust the care plan accordingly. Rehabilitation diagnosis. Impaired skin integrity, acute pain, disturbed body image, anxiety, and fatigue. Education about self-examination. Breast self-examination is a simple method for individuals to check their breast for change, like lumps or swelling. Performance won't be usually a few days after menstruation. Breast self-examination helps detect the early sign of breast cancer and encourage prompt medical consultation. It complements but does not replace mammogram or clinic exam. Then we have a brochure to explain the breast examination.
Causing here is a bit of difficult problems, which oradan geçti, bir görüntü geliyor. Nasıl görüyoruz? Program ise önemli bir ulaştırabiliriz. Düşündüğünüz ama bazı detaylarına benzerler şey onları bir de riski vardır. Bir kadın belki bir kadında meme kanseri demek normal bir şey olur. Ama erkekte direkt yaratıyor. O yüzden ona bir o ailenin kadın hemen izleyelim. Hemen izleyelim.
What's the breast self-examination? A simple, quick method to check for change in your breast. Help in early detection of breast abnormalities. Should be done regularly along with clinical breast exam, mammogram. Why is breast self-examination important? Breast cancer has a high treatment success rate when detected early. Performing self-examination helps identify changes in the breast.
Don't need all parts. Biraz büyük arkadaşların görüşünde. Zaten anlattığınız şeyler.
Yaklaşık şey.
Bence de
Buraya geçiyor.
İstenme diyorsa sen böyle söyleyeyim. Did you see any program, education materials or video for female? Ne diyoruz ona? Breast, about the breast examination, yes.
For me.
Yes. Hiç görmedim. No, you know, already my major is gynecology. So always I am looking resource about the females. But I am wondering, did you see any male self-examination video or material in surgical nursing class or during the health as public health classes?
No.
I guess it is a big dilemma, it's a big gap.
Mm.
Because breast cancer is a risk for men too, right? But even if I haven't got an idea about this examination method, I don't know. Probably the same. Okay, it is same. But we should know.
Mm.
After class, this is our homework. I will do. Please search literature and videos about the male self-examination, male breast self-examination methods. Okay. Yes.
And then we said that if they remove the breast as preventive measure, that means it's not breast cancer. But that means they say chance like the person that has breast cancer. Like if the person has a history of this, if the person has history of breast cancer,
If a patient with a history,
yeah, like family history of
Yes.
breast cancer, that means there is cancer like in the family. So if the person removes the breast as preventive measure, so that means the person might stay out like another form of cancer since there was a like cancer. Is there a possibility?
The different kind of concept.
Yeah,
If that can be long.
Yeah.
preventive surgical operation prevent a woman from the breast cancer, right? Because there isn't breast tissues, right? But of course, this be a good question. BRIC1 and 2 genes have a relationship between ovarian cancer and other cancer types too. Okay. Yes, you can prevent women from breast cancer, but cancer can be in the ovary too. Okay, or another organs too, because many cancers histologies similar to each other. They originated from the same histological origin. Okay. Yes, we can prevent from breast cancer, but other cancer is a big question mark. Okay. Good question, Precious. Well done. Uh-huh. No, göster. Zaten anlatacak mıydınız? Kendisi Yok, gerek yok. Because you will talk about it in the education part.
And we have article. This one, breast cancer, epidemiology, risk factor, classification, prognostic measures, and current treatment strategies. This article provides a global perspective on breast cancer with 2.3 million new cases annually. It highlights the case factors, including age, gender, genetic mutation, and lifestyle factors. Discusses the various classification system used to categorize breast cancer based on molecular subtypes and prognostic markers. Stresses the importance of early detection and personalized treatment to improve survival rates. The other one, recent advance in breast cancer research, focus on new development in breast cancer treatment and diagnostic, highlights the discovery of new biomarkers and molecular targets to improve treatment effectiveness. Discusses the role of the tumor microenvironment research in understanding cancer progression. Emphasis precision medicine and personalized therapy leading to better patient outcomes.
What is the new biomarkers and molecular targets according to this article? Bak, önemli olan işte. Hani bu özette yazıyorsa o kısmı sadece özetten almak. Ama içinde
What is a new biomarker and molecular targets?
we have
For this
BRIC one.
cancer.
Probably they discover a new biomarkers and new genes
New
or
genes.
molecular things.
Mm.
This article directly focuses on these things. Okay?
Mhm.
O yüzden, so guys, I want to,
We read that.
yes, you read
Next.
this article, then,
Mhm.
thank you. Next lesson,
Mm.
please share with us. Okay?
Article 3, application of evidence in subjective radiotherapy.
Sorry.
Breast cancer. Examine the effect of evidence-based nursing practice on patient undergoing radiotherapy. Findings indicate reduced complication, better pain management, and improved quality of life. Highlights the importance of nurse-led intervention in minimizing side effects and enhancing recovery. Reinforces the role of the patient education and physiological support in post-treatment care.
I want to say something for new biomarkers. Maybe liquid biopsy or maybe AI integration can be.
Yeah.
Yeah.
Please give the full name.
And
Artificial intelligence.
Okay, good. Please bring this thing in the class. Now, all students have an idea about the ultrasonography, like mammography, MR, we know that. But we need
The
new
name.
things about their, or maybe there is new biomarkers.
then we distribute one AI on the health AI. We give mammography and he or she detect early detection.
Neydi mesela?
Hocam şey işte mamografi nemarini atıyorlar. Doktorun bile görmediği şekildeki o işte başlangıcı kendi tespit edip şey yapıyor.
Turkish class.
No, and then it's a new project such as we call them reading technology. Do you know? Giyilebilir teknoloji Türkçesi say giyilebilir. Readable. And reading technology such as intelligent phone watch. Okay. Or there is a şey ne denir? Bra, air bra, you know, air bra. In Turkish you say sütyen. Okay. New technology, air bras, you know, that directly touch the breast and via body temperature, measures body temperature can detect breast cancer. And we call it this technology can we bir baksanıza nasıl geçer? Can we read technology? Watch, intelligent watch is one of them, okay? Intelligent bra, air bras. Bra, you know, bra?
Bra.
Turkish sütyen. Also, there is different new innovation in the healthcare, dear friends. Many patients sit their home, but their data, their biomarkers, their body's size sense via technology to the physicians. Okay, not only intelligent, neydi onun adı? Intelligent artificial intelligence stay in a computer and create data. Okay, they need a human body, of course. Yeah, artificial intelligence needs data about the human body, and they receive this body from the clothes, from the watch, from the glass. Okay. Mesela şimdi aç bakalım. Wearable ultrasound patch. Wearable patch can detect the amount of the postpartum bleeding and can do the diagnosis about the hemorrhage. Okay, they inform physicians or women say your bleeding is too much, you have a risk about the hemorrhage. Bunun dışında ne var? Mesela başka? O Türkçe ara. Türkçe ara görürsün. Bilebilir teknolojide. Now we search in Turkish. Watch, wearable technology, şuna bir şey yap. Generally, athletes use this teknoloji. Meme kanseri de oradan da belki çıkabilir. Meme kanseri iyilebilir teknoloji. Neyse. After class, I want to search about this issue, okay? What is wearable technology? Okay. So, I want to you bring the things like this, okay, new things to the class during your presentation. Teknoloji kaldıramadım.
The last the caring for breast cancer patient is a work that brings sorrow. Explores the emotional ethical challenge faced by nurse caring for breast cancer patient. Nurses experience physiological stress, grief, and emotional exhaustion regarding institutional support. Calls for better coping mechanism, mental health resource, and workplace strategy to support healthcare providers. Emphasize the need for the emotional resilience training and professional counseling to sustain nursing staff in oncology care. Yes, Sanjay. Breast cancer is a common and potentially life-threatening disease that involves the uncontrolled growth of abnormal breast cells. Early detection through regular screening, including mammograms and breast self-examination, is key to improving outcomes. Treatment options such as surgery, chemotherapy, radiation, and hormone therapy depend on the cancer type, stage, and genetic factors. Nursing care plays a crucial role in managing symptoms, providing emotional support, and ensuring patient education. By understanding risk factor, complication, and pathophysiology of breast cancer, individual can make informed decisions about prevention and treatment. And we have resource, Hocam. And thank you for attention. Do you have any question about the breast cancer? If I don't, Hocam, we have a video. If you want, we can watch.
It's good. İzledim olabilirsiniz ama şimdi bu mesela size değerlemelerin özeti olduğu için asıl bilgiyi alamadım. Değil mi? Yani içindeydi. İki çeşit araştırma var. Direkt araştırmaysa orijinal araştırması o özette o bilgi de olur. Mesela şu markalı şey var. O yüzden when you search article reference, you can see original articles, meta-analysis, right? Or derleme, or case reports on the literature. On the original articles gives the summary about the direct things about the article. Okay, for example, an original article which is search prevalence of the breast cancer in Turkey. It's directly say in Turkey, according to our research, we detect 1 million Turkish woman carries breast cancer. And this is a direct result. But other your friends
Secondary.
examples about the how can I say you general derlemelere ne diyorsunuz? İngilizce nasıl öğrettiler? Araştırma dersinde derleme. In Turkish you say derleme.
Like secondary
Yes,
secondary
secondary
resources. Mm.
They only give this summary
Based on the first
in
one.
the abstract.
Yes.
Breast cancer develops when
Oh.
normal cells start to grow
It's not
and divide
primary
uncontrollably, forming a mass or tumor in the breast tissue. These cancerous cells can then invade nearby tissue and potentially spread to other parts of the body. The breast tissue is made up of several different types of cells, including ductal cells, lobular cells, and connective tissue cells. Ductal cells line the milk ducts that carry milk from the lobules to the nipple. Lobular cells make up the lobules, which produce milk. Connective tissue cells provide structure and support to the breast tissue. Breast cancer can occur in any of these cell types, but it most commonly develops in the ductal or lobular cells. In some cases, breast cancer can also occur in the connective tissue cells, but this is much less common. The exact cause of breast cancer is not fully understood, but several risk factors have been identified. These include age. The risk of breast cancer increases as a person gets older. Most breast cancer cases are diagnosed in women over the age of 50. Gender. Breast cancer is much more common in women than in men. Family history. Women with a family history of breast cancer, particularly those with a mother, sister, or daughter who has been diagnosed with breast cancer, have a higher risk of developing the disease. Genetics. Some genetic mutations, such as mutations in the BRCA1 and BRCA2 genes, can increase the risk of breast cancer. Hormones. High levels of estrogen and progesterone can increase the risk of breast cancer, which is why hormonal factors such as early onset of menstruation, late onset of menopause, and use of hormone replacement therapy have been linked to an increased risk. Lifestyle factors. Certain lifestyle factors such as obesity, lack of physical activity, alcohol consumption, and smoking have also been linked to an increased risk of breast cancer. Once breast cancer develops, it can spread to nearby lymph nodes or other parts of the body through the bloodstream or lymphatic system. The spread of cancer to other parts of the body is called metastases and can make treatment more difficult. Breast cancer can often present with a range of symptoms, but it is important to note that not all cases of breast cancer will cause noticeable symptoms. The most common symptom of breast cancer is a lump or mass in the breast tissue. These can often feel hard and immovable and may be painless. Breast cancer can also cause pain or tenderness in the breast tissue, although this is not always present. Breast cancer can cause the breast tissue to become asymmetrical or to change in shape or size. A discharge from the nipple, particularly if it is bloody, may be a sign of breast cancer. Changes in the skin of breast, such as redness, dimpling, or puckering, can also occur in breast cancer. It is important to note that these symptoms may also be caused by conditions other than breast cancer. So it is important to see a healthcare provider if any of these symptoms are present. Additionally, some cases of breast cancer may not cause any noticeable symptoms, which is why regular breast screenings, such as mammograms, are so important. There are various types of breast cancers. Some main types include ductal carcinoma in situ. This type of breast cancer starts in the milk ducts but has not yet spread.
Geçmiş anlatacaksınız galiba. Bitti mi konularınızın tamam?
Önce postlar var. Postlar gördüm. Anlatayım mı?
Yok kalabilir ama şey değil. Şöyle bir o zaman özetleyin. Mesela bir kanseri önlemek için, meme kanseri önlenmesi için ne yapabiliriz? What should we do for prevent society or your patients, okay, your publics from the breast cancer? what are your advice to young generations?
Advice the lifestyle. As I said,
Okay, right. What should be changed in the lifestyle? What kind of lifestyle is good?
you avoid the fast food
Mhm,
and you have to maintain the normal weight.
mhm,
Uh,
Alcohol consumption.
yeah, alcohol, cigarette.
mhm,
And then we have the research to breast cancer.
mhm.
Uh, you have to learn how can the breast self-examination and changeable visual coming breast because of the some this generation if they some change she didn't tell the mother or anyone because it's normal but it's not you have to learn and
Regular secretary. Provide the education, self-examination.
Good.
Güney,
So if possible breastfeeding. But if possible for one breastfeeding, very important.
I want to say something. What can you say about phantom pain related to women that have mastectomy?
hormon, I didn't.
Good question. But please repeat yourself.
I said, what can you say about phantom pain related to women that have mastectomy?
Do you know phantom? Phantom.
Mm, I don't, I don't know. I can explain this.
Like phantom pain, just like
Yeah, I know.
you know what it is.
Okay.
I'm not being, but I don't know.
Because
Um,
surgical operation, woman feels get about their body image, right?
why I say this is because I saw online, because we always say phantom pain is like a pain that someone lost a body part and they're having pain. What I saw online is very, very serious because the people might just be experiencing a lot of pain from that body part that was missing. They were even shaking, crying. So what I was like asking, what can you say or what can like a nurse do, to support this patient is very, very important. Okay.
Okay, good question. Should be our solution.
Because phantom pain is something we don't know when it's being phantom, we can't control, we cannot know like the pain scale.
Mm.
So the best thing we can do is just try our best because I don't think the amount of painkillers can help relieve the pain for the patient. What we can do is like maybe we can try the vision therapy for the patient and encourage them to do other things to distract them from the pain, even though it might not be 100%. At least it's working, it's like halfway that helps the patient, and we just need a lot of encouragement and the society of other people to know what works for them, what not works for them. Because that's the least you can do. You can't like really give them rules.
Yes.
And it can increase their chances of addiction. So more than this, just go through the psychological way and like emotional support.
Yes, emotional support, psychiatric support. Yes.
And
Something else we can do is for a woman, she
Mm.
can just stand in front of a mirror and see by herself that the part of the body is not there, or the breast is not there. I think it can change her
Perception.
perception.
Perception.
It's
Right.
good.
And before the after surgical operation, before the surgical
Before
operation,
the surgery.
they need support,
Mm.
professional support, not
Mm.
only relatives or a
Mm.
nurse or a psychiatric nurse,
Mhm.
a psychiatric
Mm.
therapy
Okay.
is
Mm.
for these groups.
Mm.
And give us this question, yeah, 20 years ago is so
Mm.
important because there is very dramatic attacks
Yes.
we can see in this patient. But today, thanks to God, thanks to technology, we have very good implant. Okay,
Um,
after surgical
surgery.
removing,
Mm.
plastic surgeon put implants like silicone, you know, in
But
you say silicone.
Oja, sorry, not all women agree to these
Yes,
implants.
Yes, I will come to that.
Okay.
This is good for around the reproductive age for a young woman.
Women.
Of course, after years, for example, around the 70 years old,
Mm.
Some will say no,
No,
I
I
don't
don't
want it.
Mm.
Also, surgeons say
Mm.
isn't fit for you, for your,
Oh,
and they suffer from.
yes.
So we should
Even
always.
they even suffer from online troll, from bully, because I saw it. They were insulting, like bullying the woman, like where are your breasts? You look like a man, saying all kind of things also.
Interestingly, after hysterectomy, you know, hysterectomy is removing uterus.
Mhm.
A woman cannot see the uterus, right?
Mhm.
But knowing it isn't that
Then,
affects woman's mind. Okay? So you are quite right. On mirror, without breast,
Ah,
you
yeah.
won't feel this.
Interesting. Thank you, Oja.
So we have again.
Hocam before we begin, mastectomy için ayrı terapisi önerebilir miyiz?
Olabilir. Yani bunu orada çok çeşitli different kind of therapies. We always encourage women take professionals. Pens. We have Ha, evet, ağrılara iyi gelir. Yani komplementary terapi. Ama özellikle de sonraki bir şey engel aşamak. Yani düşünün yüzünüzde bir çizgi bile oluşması nasıl etkiliyor? After this game, we can give a break.
Okay.
Then 50 minutes, I guess, not, right? Then we will meet here for second presentation. Nasıl? Aslında öyle bir sanmıyorum. Bana bir
I'll support my camera, brother. Yeah. No public service.
Please wait. Hadi herkes şey yapsın. Şeyler bırakın.
Hocam fazla katılımcı var, ben de başlayalım.
Böyle herkes çeksin. We are waiting you guys.
Yes.
O tarafınız nasıl?
Hocam değiştirelim.
Yok hayır güzel senin.
Başka
Evet, iyi bir
Paris'ten şu an.
Evlensen
Ondan çekin. Sağ yukarıda.
Diabetes. Where's my mastectomy? Fatima.
Ya.
What's does
Mavi seçen açabilirsin.
angiotensin?
Eyvallah.
For 25 years old ladies, we need extra 5 seconds.
I think the answer is big. Yeah, it's too long. Child is a common medicine diagnosis for breast cancer patients. Distal body image.
Kırmızıyı seçin atlasın. Pelin nerede?
Hmm, 5,000. Which one? Addition. So sharing. Not sharing. The blue one. I think it's the blue. Press. Yes. Fatima. 7. What is recommended frequency for performing a breast? Oh, this one. Should be monthly. Monthly, yes.
Tek kelime oldu çok.
Why is early detection of breast cancer important? Should be red color. Red Fatima. No. Sean is yeah. Why you guys use Turkish here?
Because we can't change.
Some people press yes. Okay. Last one. If is it true, true. Fair. Fatima.
İşte bazı telefon santimlik farkları var. Bu testler.
We can do the we can party for in emergency care nursing class. Around the yes, end of the class. Okay, do you want?
Ojan Patsy. I'm not taking the course. Ojan.
We are not invited.
I took course last semester. Am I invited?
Ah,
It's our last semester.
no, yeah.
Okay. What time? Okay. Okay. When is Ramadan? Last day of the class. Okay.
Then halk sağlığında müziği sürmezsin.
What are you presenting? I will ask you question.
Don't try.
I'll ask you question. You particularly. You have asked question.
Actually, you asked me after I will go. Ben de güzel şeyler yapıyorum yani bu arada. Yani böyle becerilerinizi önemli. Sonunda mezun olacaksınız. Geçen sınav sağlığı yapmıştık hocam. Nasıl Güzel olmuş. Güzel olmuş.
Ben zamanında
Değişiklik yaptığında da yok hocam. Ha, ben belki yoksa gidemeyeceğiz.
What honors thing?
Olur. Benim açımdan sıkıntı yok. Bence sınavları güzel gidiyor.
Okay.
I said,
Kiss.
it's not his keys.
Oh, yes. Okay. Going on.
Pass by 12.
By 12. Which class?
I have another sick course.
Anything course.
Yeah. Somebody
Let me
asked me.
answer this question.
Somebody asked me to ask you something.
Yeah, what's that?
Which one? Number 60.
Yeah, I don't know.
Number 61. They had any client. Where did you get this question from?
Online.
The other client.
You want it?
Cardiac unit was. No, don't worry. I don't want to blow my head. I know this. The other client on the cardiac unit was found on the floor by the bed. Cardiac unit. Elderly client 1 on the cardiac unit 2 was found on the floor 3. Which information should the nurse document in the client's chart? Fail. No injuries noted. Incident report completed. HCP notified. Found on the floor. No complaints of
I hate
pain.
asking questions like
Able to move all extremities. States no one answered call lights. Attempted to get up without help. Got out of bed without assistance.
you don't read that say like
Got out
100
of bed
times.
without assistance and fell
Which
to
number am I?
the side.
63.
Definitely not 4.
It's definitely not 4.
And definitely not 3.
Why? Why? I've not read it, sir. Which one are you reading?
61.
Yeah. Okay.
It's not 4.
Client on
And
the
it's not
cardiac
3.
unit was found on the floor by the bedside. Which information should the nurse document in the correct? Fell, no injury noted. We don't know that. Incident reports completed. I don't know. Found on
This question is not complete, literally.
see, somebody fell on the
Because
floor,
it just
right?
says the elderly client on the cardiac unit was found on the floor by
No.
bed. It didn't tell us
Okay,
what
we
happened.
didn't know. Okay, found on the floor. That means the person fell. Wait.
Nope. What if you just decided to lie down on the floor? But they said cardiac. So it's this unit
Yes.
talking about
Wait.
cardiac unit.
Found on the floor by the bedside. Okay,
So I
wait.
cannot say he's got out of bed and assistance because there's a reason why he's in the cardiac unit. It's probably he's having heart problems and stuff like that. So states no one answered. Nah, it's not these 3, it's not 4. Found on floor, no complaints of pain, able to move or extremity.
We know that.
Injuries noted. Incident reports completed. HCP. I'll pick number 1 though.
What number? Let me write by 2. In case I need to mark it.
That one looks more realistic actually. What's HCP actually? I don't know.
Healthcare provider. What do you want to tell me?
Healthcare provider.
Mm.
Oh, somebody said I should ask me. And the person was like, the person said I should ask you, do you want to sell your phone?
No.
It's actually someone from the hospital.
Take. What do you think?
I do. Right?
Yeah, it's not a big name, I'm not even interested.
Yeah.
What is this? Question. What's the question? Prioritization question.
Wait, you want me to?
Help me to answer now.
Which one is
Help me
that?
to answer 61. What do you think?
Okay.
I write by Timmy.
The other week.
So why yes, why are you guys presenting before us? I think it maybe Ojan won't be around the time we want to put.
Yes, yes, I think that's why.
Is your thing recording?
No, I'm doing YouTube something. Okay, so has even finished, Seth. I'm live streaming. Nobody even likes the video, Seth. Anyway,
They live stream on YouTube.
not on YouTube. You pay for it. 16 subscribers.
Share it on platform now. Let people follow. Wait, the story.
I don't want to share big.
Oh.
Why?
Share it now.
My father WhatsApp. That's where I had a lot of people that if I know I share, I have lots of people. But I changed it to Turkish. So I don't really have for people here. This is by Timmy. What do you think? Can you see it? Should I
Yes, I
increase
can see. No, it's okay. Hey, just reduce it.
it? Really?
Yeah, there you can. I think 3.
Terry.
Wait to got out of bed. Don't assistant. It's 3 and 4.
3 and 4. You have to pick one. Me safe request is so coffee. Get out of bed. We don't know if there's any.
Oh,
If
ready.
there's see this thing is tricky. We did not just find the person on the floor, right? They didn't tell us if the person have any injury or one thing. So how do we know this person does not have no injury noted? I don't know. Incident report complete. HPV found on the floor, no complaints of pain, able to move or extremities. Wow, it's number 2. It's number 2. It should be number 2. Yes, by hope.
Okay, true.
It's number 2. I don't know. I'm not sure. Maybe
Which question is that?
61. What's the answer?
I mean, which
To me, pick
exam is this?
prioritization management question.
You're doing a course. Is it a course?
No, I'm
You're
sure.
just okay.
I like prioritization question. I see what I can do.
Which of your phone is connected to this? No, it's both of them actually. Open it.
Why do you think? To me, pick one. I think that two is correct. Why do you
need
think
to
so?
ask which
You need
information.
to know why.
There's
Why
a reason
why I
explain
picked number 2 though.
Okay, what's wait, let me read. Okay. Sure, no injuries noted. Incident report completed. Please be notified. Found on floor, no complaints of pain. Able to move. This is number 2. States no one answered call light. So attempted
Jesus.
to
Hope so. I used to listen to lectures. Hey, I
got
don't die.
part of them.
I feel so serious. Jesus. Ah, even downloaded lectures on Spotify. Hope you be serious student.
Yeah, taking my answer.
That number.
Get lectures on Spotify.
Because you are the one. That's what I'm saying.
Okay, I feel like why do you pick number 2?
It's clear and
There is one thing I saw that just made like this
Lectures on
might be
Spotify.
no complaints of pain.
no.
This
found
is
on
found
the
on the
floor.
floor because you just went there and you saw the
You
person.
saw him on the
So
floor.
you
It's a
repeat
more
it like
formal
that,
way
right?
to.
Okay, yes. This
And
one
you
I read
asked
it
him.
again. I like found on the floor because in the question they said was found on the floor.
Yes. And then they say, and then you ask
Wait,
him
so
if you
do you
had
want
That's
to
the
speak
thing.
Spanish?
you
Is that
now
crazy?
made him walk.
This is not assessment.
Check the answer.
One. Am I right? That's correct.
No, what do you mean is correct?
You know.
Oh, what do you find this?
Where did you see You want to
Red fellows as a red.
Oh, connected.
I'll tell you, I am not that thing.
61. 61.
Yeah.
Oh, yes,
See,
now.
all these answers are
Just
in
a
the question.
formal way.
Yeah,
Yes,
you
like
just have to read and comprehend what we are reading.
examination.
To me, it's the answer I picked. It's when I was reading. It's the answer I picked. One is wrong.
So what was the answer?
and the second one was
Let me
very, very.
What was the answer?
Yes.
What was the answer?
Two.
Two.
Found the nurse should document
This is a very
exactly
stupid
what
question.
was observed.
So it's not even a direct question.
The statement is correct.
The one said it means that you were there, you saw her.
So it's not even a direct question, Seth.
It was direct.
Very direct. You came in, the patient was on the floor.
Uh-huh.
You are good
They
with
want you to
prioritization.
The one you choose, it's like you were there and the patient fell.
Yeah. Yes.
But this one now you came.
Came.
Found
Found
on
on
the
the
floor.
floor.
You
You
don't know if
report
he
it
fell.
as the way
You
you
don't know
saw
what
it.
happened.
You saw it.
Well, in the question, shall I tell you she fell, but you came. You don't know if she fell. You
Yes.
don't know if she went and she lied there.
Yes, that's true.
That's
Found on the
So it's
floor.
found on the
Even
floor.
I read the question with Joanne and I'm like, found on the floor.
Yeah.
That's it. That's
I
found on the
came and
floor.
I just saw her on the floor and they asked me to report. I will not say she
You're
fell.
reading the next one answer.
Oh no, I didn't even you saw the answer.
No, I didn't see it. I didn't see.
This book is different question for different body parts.
Okay, I
This
saw
is for
cardiac.
Did you like
this is for
did you
cardiac.
purchase it or you just saw it online?
I saw it online.
And you just download it. You know.
So this one, home health community question, elderly clients. Which nursing task should the nurse delegate to? What is HH
Home health.
Okay, that's assistant to this home health person.
I know.
You understand the question?
HH aid.
Eight. Yes.
Okay. H
Mm,
she's
mm,
the assistant.
This thing that blew off my head.
This is delegation question.
Please don't say your answers out.
Okay.
No. Oh, we
Wait.
should not say the
Hurry up now,
sorry.
please.
Is it just one answer that is correct or
One. No. Take-
what do you have as answer?
I think two. What's your answer?
So I think.
I
But
think
they said the home health nurse.
nurse is caring for an elderly
So that one too in the house, her assistant is also a home health assistant.
Yes.
So number two.
Number
We can,
two.
number
Why did you
Everybody
pick number
picking
two?
number
we can't
two.
take the
Why did
client.
you pick? We might be wrong, go. So don't think
Number
because you
three,
picked.
No,
take
number
the
two really
client
sounds
for
correct.
outings to the store. That's not her job. Maybe there might be somebody else in the house that can do that. But if she's
Our
What about
house,
4? 2 and 4.
no,
They cannot
four,
monitor
they
mental
can
status.
monitor
You can delegate
a help.
assessments. What again?
Mm.
What? How did they even say it? Patient education. You can't
You can't
delegate.
delegate it to.
Assessments. You can't delegate.
Yes.
Monitor is like
Okay.
assessment. No, you can't
Okay,
delegate.
that means
delegate
that means it's
Who can freeze?
that
That
means
one too is
yeah.
strong. That's what I think. Oh,
Okay, let's check 62. I've been doing since I've not been checking the answer. I will just mark all of the ones and see.
at the end.
If you see what I get for one out of 20, I was like, damn. What's that? 62, right?
Mm.
I don't want to.
It's 40, 43.
Okay.
Mm. It's here.
Oh,
See this one.
So,
wow. It's so good. In fact, I'm learning from you. I swear.
so,
You are so good with prioritization question. I don't know how you do it. It's when I was
it's just
it's
the
when that
in that
summer
hospital.
that I was studying that
Eh,
summer. That was when I was not getting some ideas about
Yes.
it. All these ones are the ones I did. I don't. Okay, all these ones I did. You guys can check,
Okay, no.
but I don't would take.
58. The next is ammunition, medication, supply, and medication. The next question.
You know this is the wrong answer they are looking for.
They are looking for a wrong answer.
Yes. What can you question the daughter about?
Mm.
Okay, is it this one we're reading or the
Mm.
first one?
You can
Okay,
read
58.
The patient is having
I don't even know medication. I'm ashamed of myself.
which medication should the next question? Wait, I don't know medication.
I want to
feel like
check what is
everybody
different between
thinks-
anticoagulants and antiplatelets. Is there a difference between these two
Platelets
things?
and blood, they are different.
Wait, coagulants is
Coagulant
blood.
is blood. It's blood that comes. Anticoagulant
Yes,
prevent
together.
from blood clots.
Platelets.
Platelet, it's inside the blood. You know the blood is 3 types. There's a platelet, there's a white blood cells.
But if you are
red blood
giving
cells.
antiplatelets, so wait, I don't even know.
Platelets in the blood, they are like
Okay, so if
molecules
you are
in the
giving
blood.
platelets to person just to increase their platelet level.
There's no
Ah. So that means this is wrong now. I was thinking, they say they don't give anticoagulants to patients before surgery.
Yes.
So it's not this one. Since
So
it's
what's not the
different,
answer?
I don't know. I've not checked the answer. Those five. Okay, I want
No,
to
it's
know
not
the
the
difference.
questions here.
This is expected outcome now. If you give ACE inhibitor to patients that have low blood pressure. Oh, wait, ACE inhibitor is to what? Lower the blood pressure.
What?
ACE inhibitor.
It's inhibitor.
If we give it to patients, they give it to patients with hypertension, right?
Yes.
To lower the blood pressure. That means maybe it's number 4. I don't know.
Here you see.
Is what?
Anticoagulant slow down blood clotting. Antiplatelets antiplatelet agents prevent platelets from clumping and also prevent clots from forming and growing.
Oh, so it can't
Like
be
a
that one.
platelet, let me check.
So that means it is 4.
I'm thinking, I don't know. What about loop diuretics is something mean? I divided it.
Look at how the platelets look like in the blood.
Oh, this is in the
But
blood.
But they are part of the blood. You know the
Okay.
blood has 3 parts.
So what's the
They're like a
answer?
molecule something in the
Yes.
blood.
What's the normal urine distance for?
Is it not 30 ml per hour?
So now in 4 hours, how many distance? 30 times 4.
But they have
What?
loop diuretics. It's to
20
remove more urine from the
Okay.
body, right? What? Wait, Timmy, did you see
This partial of this thing is amazing.
the words?
I was not lost.
They play.
The anticoagulant is also
At this point, tell your cash.
yes, it's medication stuff. 58.
Right? All these international exams, they say you need to know medication.
Imagine.
I feel like it's where? Me, I don't know. Yeah, I'm also in the shoe too.
Everybody.
Medication side.
Please 54, 56, 59,
58.
Damn.
It's here.
58.
Oh,
Hey,
Sorry.
you're not understand.
That's what I picked before, guy. Guy.
They will increase bleeding. Yes, now.
Imagine, that was what I picked before. But I
But why
picked it
did
for
you
the
check?
wrong reason. Because I was saying, oh, coagulants, you don't need to take it before surgery.
Yes, it's the same.
You didn't fail. You had it correct. Yeah, you even got it correct.
But you know, if it's exam, you fail the answer because
And
you
you
change
change your mind.
you change your mind. Let's do new one. This one is two. Got it. We'll start from here. I'll check the remaining side.
We did this one, but
No,
we did 62. We didn't do.
you didn't do quite a method to at urine output means RO.
RO.
Urine output. So the client admitted to.
Urine outputs.
I'm not sure. RO is you. RO is not urine output.
Administrative.
It's IO that is urine output now.
Oh, IO. RO.
IO, Abi.
Okay, it should be IO.
Abi, UO self. IO. Please check for what RO is. You see? UO.
UO.
Please check for what
UO before. Wow.
It's just the initials, U and
What is?
But you know that in one this night, so they say if you are reading a question, you don't know the meaning, don't focus on that.
It's full out.
Focus on other things.
They gave us the meaning.
Yes. Rule out. Oh,
Actually refers to diagnosis of that.
Sorry, interrupt. How many minutes are you planning on this thing?
No, we don't do time.
you know it depends on the teacher that
Like I still like an hour and a half.
because the teacher was explaining.
Don't worry. We'll not.
Don't worry, yeah, our instructor does not do many. This question will kill you with.
Okay, it's continuing. Just
Substance.
to the left and your
This is Ajana.
Look.
Which
should be ready.
Oh, I know the answer.
wait.
Oh, this thing I learned is helping me. I swear. I know the answer. What do you guys think?
What is HCP, please?
One healthcare provider.
Okay.
You are a nurse, so number
Mhm.
4, you are not doing number 4.
Mm, mm, mm, mm, mm, mm. I can say the answer.
You can't take the client's pulse and blood pressure.
Mm, mm.
And we can't do this ECG, right? Oh, wait, ECG. ECG is this thing now. I was thinking ECG was this one.
Wait,
Call for a start.
I don't even know, but I think that's the answer.
you think that is the answer?
No, not serious.
What do you think is the answer?
Sublingual is
You guys might laugh. Oh.
why?
I think one is the answer. You know why? You want to do assessment before any other thing.
But the patient is having pain in addition to the.
Okay, it's having pain. Why is that patient having pain? Do you know if it's other thing?
Okay, I thought he was having stroke. I thought they said
Okay,
it's not
do
working.
first.
Yes.
But is it not one? Because you always
you.
Hello?
63.
Yeah.
Like, if it's not one, then.
Good afternoon.
Oh.
63.
I mean, it's 50%.
Oh, I don't know. I'm still in class.
No,
Number. Hey, you guys. You guys. No.
placing nitrogen under. Hey, wait.
You see, I say don't follow my maths. I might be wrong. Why is the answer wrong? Why?
My mind was even telling me, but I didn't really know what this nitroglycerin is.
It's medication for people that have angina. Angina pain, nitroglycerin. They give them. It's oral drug. You put in your mouth. How
And
did
they
you
said
get?
draw.
I know it's angina that is doing that person. Not should document exactly what's observed.
Okay, I want you to by 2:30. By 4:30.
Right. 63.
I will just let you know. It's fine. So
Oh, the thing they
what
already
did they
said was
explain?
in the question already, so there's no need to go and
It's
ask that
in
again.
pain. Yes. Wait, where is the I want to read.
This is not saying it's not. You need to think very well.
Not judge something.
That's why I wanted to do
Completion.
leadership.
Oh, that's why you want to do leadership.
But I can't do it again. That's
But
part.
it's like management too now. These are the
Uh,
some people I don't know.
which
63.
question?
63. It's the way I even believe that that's the answer for myself.
To the hard model.
This is how you go home, be feeling so proud of yourself, and you see results and ask yourself question. What did they say, Chef?
Read the number one. The patient is in pain.
If the client is in distress, assessment. Wow,
You
that's
know already
true.
he's in pain. You take it. You can
Assessment
already
is not
imagine
the
what
first
will be.
intervention. If there is an action, the nurse can take to relieve the
Let her
distress.
take.
The nurse should understand.
But I.
That's that's true. That's true. Timmy, call that boy. Timmy,
It's lost.
turn this thing. Let me see first. Turn that screen. Let me just see. Okay.
Don't worry. You're about to come to see. I've seen how much you have.
Yeah, now.
Oh, do you use paper?
No, I use gray. But I'm trying to do my pioneer sha. That pioneer is so stressful. Wow, we still finish this thing. Wow, I'm so proud of myself. 64. Okay.
Put the answer.
Yeah, like putting the answer. This one is 0.
And 3.
But you know the funniest thing, I told you this person have vagina. And vagina, they give them some paper. I don't know why I read into the question. 64. Client. So you people like doing this center.
I like it because
I thought
it
you
makes
guys
me
would like
think
it.
out of the normal.
I like doing this like this kind of time that I don't have anything to. I find the cardiac clinic have okay.
You can buy a house in Kentucky.
Huh.
For 100,000. 100,000 for us to try.
I don't understand the question.
Depends on the cardiac clinic. That's a cardiac clinic. That's a cardiac arrest.
Very important something.
Which is the administrative support.
Since management, this thing they was teaching us
Intervention.
supervisor,
During the
administrative supervisor.
number one, they said begin to take notes. No.
No. Wait.
The code.
Say it in your mind.
Okay. Okay. I have my answers.
You have the answer already.
I
Guy.
don't know.
Please, you know what to do now?
Wait.
Well, how about when we get the answers, we should just check the answer? Or do you want us to discuss our answers?
Okay, we just check them and discuss.
Oh, we can discuss it now.
Okay, we can discuss.
John is there already. Said, check this one. Check your answers. It's not even okay.
Wait, what was the last thing? Which is the administrative supervisor
First
intervention
During the code.
Where?
What do you think?
I don't know, I might be so wrong.
I think this is my own.
Make sure all the jobs are being done. Okay.
What's the answer?
Wait,
I
the
think
supervisor does not administer drugs and stuff. Because I'm thinking four. You think four?
I think you can be correct.
No, I don't know the answer. I don't have idea. I'm just like picking. 64, right?
being done.
The first intervention. Wait, for the
Supervisor.
Said that's what Soshan was telling me yesterday in management class. That the administrative, that's the supervisor, supersede.
Supervisor, just
Like, yes, she's not enough. She said the
not
only
enough.
time she works is when there is a shortage of staff, but she must know how to do everything in the organization.
That they want to do
She's
number four.
not
Then
in,
checks.
that CTA, that's, you know, the day the nurse, they have short of staff. She had to go to the emergency, no, that's emergency unit now. And she and Sarah was there. Remember? That's a shop. Hey,
Supervisor. So we have to
administrative supervisor.
So we have to make sure all the claims we
Yes.
this thing is very important.
In fact, we see all
And
these
actually
things
these
in
things
life.
now, this reading these things all the time will make you
Yes, know how
develop.
to answer questions. Yeah. Oh, I'm so proud of myself.
I'm proud of you.
Evening shift. Report back. But all these questions are so difficult.
Herhangi bir yerde kapatılır. Bir tane daha.
Oh, let me read it. First person to see first in evening shift.
Ben niye alamadım ama.
What is evening?
Number one.
Blood. Sorry, I wrote it just first. Packed red blood cell. Packed red blood cell. What? Packed red.
Is there anything that we should check? After a class.
Yes, they can be having allergy reaction. They can be.
So we
It
need
all
to maybe those
starts.
things.
Yes, it always starts. I don't know about the second unit. It always starts at the first, like when it is completing the second.
But the woman, she just came in and she found four of these patients.
Yes, what will you assess with? Person
The
completing.
patients who refuse to eat the food but ate it. I'm
Mhm.
thinking of the buds. That's not
The person completing a packed red blood cell, but they didn't mention anything is happening to this patient. I think for
But they will not mention that, normally, even if somebody's just received something.
but
still
this
have
number for the client who,
check on the
who
patient.
became short of breath. Oh,
Let's check. But
I'm thinking 1 or 4.
me, I'm thinking, I don't know why, but
the one that ate, the one that no, it's
we ate food from back home.
65.
does
You
it
can
have
eat
that?
your food. That's more like
Except if
It's
you're
a-
on
no.
dietary something.
He refused the dietary something.
Ah,
Oh,
He refused.
Tizo.
He
Let's
refused.
go back.
65. Okay. Yeah.
The client who refused to eat the dietary tray but got food from home.
But is this a life-threatening issue more than person that is ambulating in the hallway but could not breathe?
Let's say yeah, that's true, but I'm thinking of
We need to
We are
consider
looking for
the
the more correct one.
65, yeah. Two, the client being given diversity.
what happened to the patients now? Is the patient dying or sweating or something?
And I was
Saying
saying
that-
we were not
I
even
said
about the
nobody thought
patient.
about it.
When all information
The
about
person is ambulating, Sha. The person is using energy. So we expect them. This is like expected and unexpected.
Oh, I feel like
You see what I'm saying? Like, what did they say? You see, person that is ambulating is using energy. So,
okay, the patient was ambulating.
yes,
no,
it's
still number
expected.
4.
What
Number
did they
4
say?
says dyspnea on exertion is not priority if the client is exerting himself or herself. Like if the patient is working himself, you need
Yes,
that he can feel.
yes, that's expected outcome. We are looking for unexpected outcome. So they cannot, this one is what? So they will not kill themselves.
No, really.
Oh, you see, I'm just saying expected.
No.
So that means the rest are not life threatening.
It's not about life threatening. Expected versus unexpected outcome. You
Yeah.
understand? The other ones are expected, kind of.
This one actually can even go and kill himself.
That's what I'm thinking.
So that's why she has to take care of him first.
Wow. Wow, I mean, that would
we
fake
just,
now.
and we just left that one aside, like, my bro, you
Yeah.
have yourself.
Oh, damn. I paid this almost wrong. So, how many we fade now? I think almost all of them. The nurse is caring for Mr. E, a client on a telemetry unit. You know what is telemetry unit?
No.
Brazil. They always use it in this cardiac. It's like a person that take measurements, sensory of all the things that is happening in cardiac units, kind of.
Sending me all these things.
Yeah.
I'll send you.
Sky send it.
What am I even doing?
You told me to send you something, I didn't send it. I will send you.
Employed in a hospital where patients undergo continuous cardiac monitoring.
And like monitoring.
Okay, so they said
Continuous.
continuous. Okay.
Nurse is caring for Mr. A, client on telemetry. At 8:30, the client complaining of chest pain. Which medication should the nurse administer? Administer 1/2 of nitroglycerin, transdermal now, morphine sulfate 2 mg. Or codeine. You know this thing is codeine. You know codeine drug.
So we really need to know all these drugs.
Yes, so nitroglycerin 0.
How will somebody
I
now
pick number 4, Sha.
sublingual?
Yes.
What is a person undergoing complaints of chest pain?
Yes.
Oh, that's angina.
That's what I said.
That means
0.4.
I don't want to trust anything else.
But they put, see, they you put it here again to confuse that nitroglycerin transdermal. But we
No,
see
because
also,
can we give nitroglycerin transdermal?
they might have transdermal patch now. But this person is complaining of pain, want to relieve their pain immediately.
You can't add another thing. It will be
So we need to
So this thing here is distraction.
surface. No. Yeah, they just give information
Data.
like allergy. The patient, they will put allergy, pepperidine, the hospital band of the patient's weight, kilogram, height, then today medication.
See, the patient was already given. I think it's four. This thing here.
I think it's all the medication that they put in.
Okay, they didn't specify which one they give.
They give all this one. So
Can
sure,
we
they
check
ask,
the answer?
I think about 61.
66.
Yes, it's like cheek. You know, his phone is good. Hey. I said this thing that time when I was telling that is Ajana. It's correct. Well, yes.
sublingual.
Yes, sublingual. Okay. Let me send you this. To me? Okay, no, I need to. So shy is here. Hey, Timmy, do you need to? You need or not? I have ITL textbook. You need. Okay, ask the question. You guys don't. I normally do research. What are you saying? No. See, if you notice me, can you hear me? The day we did the presentation, I like looking for short meals. You notice? I don't like. Okay. Ask Maria a question today.
Ben de var yalan hepsini görüyorum. Kapsın. Hı.
Sınıf nerede? Mesaj yok. Mesaj atıyorsun. Class is here. Arkadaşlar bir şey mesaj
Let's go.
yarısına.
Oh,
Okay. Yes. Yes. Take second attendance, Soja.
Maybe there is any other Rojin Hoca. Belki benim odamı biliyorsun. Orada yoklama listesi var. Onu alıp gelmeni istiyorum. İki liste olması lazım. İkisini alayım.
Ding ding ding ding ding ding ding ding ding. But I'm hungry. Oh. This one. This thing is so hard. Hmm? This.
Are you sure? Okay, so this is for me. Thank you.
Sorry. Why?
Good morning class, good morning hocam.
Sorry my dear. Mesaj yazdınız mı?
Afternoon.
Eğitimde gelmeyeni artık almıyoruz. Ben dışında.
Okay, good afternoon class, good afternoon hocam. So our presentation is about loss and grief process. Loss and grief process. I am Maria Jessica. So this is the overview of our presentation. We have the introduction, aim and objectives of the presentation, definition of loss, part of the process, definition of mourning, what is a normal mourning period, when does grief become pathological, stages of grief, nurses' responsibilities in the grieving process, nursing intervention and diagnosis. So, as our aim and objective, we have to provide a deeper understanding of grief and loss, helping individuals recognize and cope with the grieving process effectively. The objective is to define grief and loss, explain the grief process and its stages, identify emotional and physical responses to grief, discuss strategies for coping with grief, highlight the importance of support system and professional help. So, grief is a natural and universal response to loss. It is a deeply personal experience that affects individuals emotionally, physically, and psychologically. Loss can come in many forms, including the death of a loved one, the end of a relationship, job loss, or significant life changes. The grieving process is unique to each person, influenced by factors such as culture, belief, and personal coping mechanisms. So scientists estimate that 9.8 of revealed individuals globally experience prolonged grief disorder, and some of them will die either on natural or violent deaths, due to unnatural or violent deaths. So definition of loss. Loss is the experience of being deprived of someone or something valuable, leading to feeling of sadness, grief, and emotional distress. It can take various forms, including personal loss, material loss, psychological loss, symbolic loss. So personal loss, this is the death of a lost one or divorced. Some people cannot face divorce. When they divorce somebody they really love, it's like the person is dead to them. Material loss, losing a home, a job, financial security, or personal possessions. Like some people, if they lost their phone now, it will be they lost the home. Psychological loss, loss of identity, self-esteem, or independence due to illness, disability, or aging. Symbolic loss, changes in life circumstances such as retirement, relocation, or the loss of dreams and aspirations. Why, when does the grief process start? The grief process typically begins the moment the person experiences a significant loss or even in anticipation of the loss. Some people, when they know that something is going to happen, they start grieving. It can start in different ways depending on the circumstances. Types of grief process, which are immediately after the loss. When a loved one passes away or a person experiences a major life change, grief can begin at the moment. The initial reaction may include shock, denial, or overwhelming emotions. The person will be crying, some of them will lose conscience. Second one, anticipatory grief. In cases of terminal illness or expected loss, individuals may begin grieving before the actual loss occurs. If maybe you have your family member that the person is very sick, and the doctors will tell you that the person can't make it, but the person is still alive, you already know that the person will die. So you start grieving. Delayed grief. Sometimes grief does not surface immediately. A person may suppress their emotion and experience grief weeks, months, or even years after the loss. An example for this, you have a family member who died. Some people sometimes they won't accept that their mother is dead, even though they'll see the mother laying in the coffin, they'll be like, no, she will still wake up. So grief is a highly personal experience, and there is no set timeline for when it begins or how long it lasts. It unfolds differently
for each person, influenced by factors such as emotional resilience, personal belief, and social support. Okay, definition of mourning. What is mourning? Mourning is the external expression of grief, which includes the ritual customs and behaviors that individuals and communities use to process and cope with loss. It is how grief is outwardly shown and culturally shaped. So I would like to ask my friends, or Ojam, please can you tell us how mourning is done in your culture? How is mourning done in your culture?
Yes, you can ask from your friends.
I wanted to start from you.
Yeah.
Yes, okay.
Okay, directly, man. Okay, I am not okay or about the morning. I have an experience about the light morning. Maybe you see the next previous, yes, slides. I ignored one of my love bed about 15 years. I never received him what is the meaning of Griffin?
Tom.
Griffin. Tom. Okay. And I think a person will be deal with within 6 months. Okay. 6 weeks is the healthy period. But maximum in 6 months, a person should be yes, believes and accept their loss. Okay, because more than 6 weeks, it's a bit pathological. And in my country or in our religion, I guess, um, uh, how can I explain? Take as important part in the culture, not in the religion, in the culture too. If you, some people believe if you accept your loss, okay, and you aren't suffer. If you accept your loss, probably you aren't suffer more than other people, okay? And these misbeliefs affects all generation, all cultures, in my society, not all cultures. Yes, I think I'm a good person about the morning. So always I want to talk, listen these topics from other persons.
Your question is in a personal perspective or society perspective?
No, in your culture,
My culture.
yeah, how is mourning?
Morning, my culture is after one death. There is a big ceremony in a specific days. For example, in the 7th days and the 14th days of the death of that person, we have a ceremony, and all gather to that ceremony, and there is a like a Islamic ritual for a dead person, and it's like that.
Okay, for my culture and I think my country as well, it depends. If you are a married woman and you lost your husband, they expect you to mourn in a way. For example, they can cut off your hair. Yes, you have to put on maybe white clothes or black clothes, and you have to cry. And they also perform some rituals as well. They have to give money or throw some sand on the coffee to like so your husband will not come back to you maybe in the dream. Then also for the elderly people is a thing of celebration. They will celebrate and be happy that this person lived long life here on earth. So it depends.
I mean, you said you have to cry.
Yes, you for the women especially because when they lost their husband, there's a lot of things going on. They might say you killed the man. So if you don't show those people want to see you, those signs that you actually love this person, you are crying, and they don't expect you to get married even maybe within like they expect you to get married like maybe after several years. So 6 months is the ideal time, but it's not enough for a Nigerian woman.
Okay, what do you serve to people? For example, in Turkey, we serve
Oh.
helva. This-
There's a lot jollof rice.
Jollof rice.
Yes, and in my culture, like for me, I'm from Delta. It's not that small town, but it's different from where people majorly you will see here. Like we can do this our native soup. They call it owo soup. It's a traditional soup. So they also cook. Yes.
Okay.
And I think you have to serve the elders from the village. They hold a great respect. You have to.
Okay. Special food.
Yes.
But not in your country or in your city. What do you serve to a person who was coming to visit morning house?
We serve them durable food. We don't have any specific dish, honestly. We serve them durable food. Yeah.
Okay. But in Turkey, in Hatay, what do you serve to people? Yani cenazeye gelenlere ne ikram ediyorsunuz?
Lahmacun.
Evet, kebap.
O kağıt yapan.
Enjoyment.
Şey yok musun?
We live in the same city, but we don't how can I say chicken or meat.
Oh.
Yes.
It's different.
In general, in my city, 40 days in the old generation, probably it is changed now, nowadays, I am not sure. 40 days, neighbors bring some food to the morning house. And this tradition is same for a post-party movement too. A post-party movement stay their home and their neighbors bring food or drinks to her home. It's a very nice tradition. But nowadays, morning don't do in the person home morning ceremony. Doesn't settle in the house. We have special house for the morning. And its relatives, friends, and cenaze elimse, cenaze everyone comes there and they give their upset to the family, and they bring lahmacun or pide, but very much amount of pide for the visitor. Yes, this is our tea, coffee,
But sorry.
sherbet in some.
How about if it's a young person, do they do this?
So
If it's a young individual.
it is very interesting. In your country, as I understand, ceremony changed according to the patient, person's
Person,
age. Yes. And it is very nice because of for the elderly patient, people, you think he or she live enough and honor.
Yeah.
And today, probably he reached He's for God
Mm.
or the earth. Okay, this is very believable
Mm.
things. But for a young people, probably society feel very
Angry.
bad. Right? Interesting. Var mı başka şey? Başka bir örnek? Neredeydiniz arkadaşlar?
Hocam aşağıda oturuyorum da ben.
Evet. Yes.
Key aspects of learning. The first one, cultural and religious practice. Different cultures and religions have specific mourning traditions such as funerals, memorial services, wearing specific attire as we all listed,
Yes.
observing periods of mourning.
Can you see your relatives in the just the face?
You
No.
can see the whole body, but you can see the whole body, but it's only on the Friday and the Saturday. You can't see it for
That's on the
Saturday.
Saturday.
So they allow young people to see.
Yeah.
When we buried my great grandmother, they didn't allow us to see. Just the elderly people just walk around the coffee and see.
In Turkey, maybe because of the Islamic tradition, only family members can see the person. Then we wrap the body with a white special cloth. And before the burning, right? Before the
Very.
yes. It is a job with a gasal. It is a kind of job in the mosque. Wash the body and then they wrap with kefan. It's white cloth known as a kefan. And then after this clothing ceremony, nobody can see the body. And during the burning,
It's true.
person we take body from the coffin and we put in the earth without cutting.
But
Doesn't
when they are washing the body, is everybody is there?
No.
no,
Only
that's private.
a female, for example, but is man. Male relatives can stay there. Hoca, imam, Gastav, priest wash the body, and one or more than one relatives. For man, male, for female, female relatives. And interestingly, past generations buy their kefan, white clothes, during their happy days, and they sell it in special area. And they said, when I die, use this kefan.
Wow.
From young age to the die, they can see their kefan. They saw.
Aynısını mezar içinde yapıyorlar.
Scary though.
Yes.
Honestly, everybody
People
could die
buy
one day. One
their
day.
tomb or mezarın adı neydi? Yes, their tomb.
Graveyard.
And they sometimes a family buy an area and say, here is my coffin, here is my husband, my daughter, my sister.
I know about my granddad. He wrote his biography himself before he died. Like he knew that this period from this period to this period I was going to die. So he wrote his biography himself. He wrote his will himself and everything before he died.
What?
Okay. The second one we have emotional and social expression. Crying, speaking about the deceased, sharing memories, supporting, common ways people express their grief. time frame. Mourning can last for days, months, or even years, depending on cultural beliefs and individual needs. Some cultures have defined mourning periods, while others allow for a more personal approach. For this time frame, for example, in my culture, if somebody died, you can wait at least 1 month before burying. And
1 month.
Mm.
Where, where do you save the body?
mortuary,
Okay.
save the body in the mortuary. Then 1 year from that period, the next year, the same period, we do a celebration. Remember something.
After 1 year, you celebrate.
Hoja, I think this is a very good ritual because I hear about so many people that wake up. I mean, they become alive again.
Okay. Yes, but it's very few things because of some medical error. We can see there's type things.
Yes,
Yeah.
what exists, Hoja?
Yes, it exists, right?
That is if they don't use that
Especially,
chemical.
dying cases
Oh, really?
with die in their home.
Yes.
Which is possible, yes, right?
Healing process. Mourning helps individuals accept their loss, honor their loved ones, and gradually adjust to life without them. It is a crucial step in moving forward after grief.
Oh, yeah, sorry. Why the death of the stay nearly 1 month? Why?
Or just there are a lot of things that happen within the time. There is prayer time. Sometimes it's more if the children of the deceased person is outside of the country. It also depends. But the period, 1 month, there's prayer time. There are a lot of ceremonies going on.
Okay.
Next. Okay, so what is a normal period? What is a normal mourning period? The mourning period varies based on cultural, religious, and individual factors. There is no fixed duration of mourning, as grief is a personal experience. However, some general guidelines exist. Cultural and religious mourning period, Christianity. Mourning periods differ among denominations, but common traditions include a funeral within a few days, a week, or memorial services, and a grieving period lasting from weeks to a year, like in our culture. Islam, the mourning period is typically 3 days for most people, while widows observe 4 months and 10 days of mourning.
Also, burning?
Burning.
Burning, yes. Sometimes I am conscious about my pronunciation. Burning always occur in the morning. We never burn a person around the evening. I am not sure about the other part of the Türkiye. Akşam üstleri görüyor musunuz hiç öyle? İkindi. Yes. Ya sabah, yani sabah öyle.
You burn the plate.
Or morning or afternoon.
You burn it or you put it in the store in the
Put in the yes, burning is same thing. Burning.
You burn it because it means you fire it, right?
Yes.
No, burning.
Okay, burying.
Burying is some body
Yes.
burying. Okay. Burying always
Burying is so technical.
Morning
That's
or afternoon namaz.
Some people prefer bonding. Some people
No, it is an Indian culture, yeah. But
only in India. Is it just in India?
no. Nowadays, many countries prefer it, but in the Islamic culture, all that body should yes
I want to ask a question if it's true.
Also for the Jewish, I guess it's the same.
When burying for your culture, do they lay them flat or vertical position?
No. During wedding, people say lateral. Okay, nothing like say lying position. But the head, look at the
Person.
Mecca.
Mm.
It is holy city in the Arabistan, in the yes, in the Birleşik Arap, Saudi Arabia. You know the Muhammad is or ne denir?
The house of Muhammad is.
Yes, the house of the Muhammad, the coffin of the Muhammad is there. So the dead body lies according to this direction.
Okay, number two,
But then they lie
Like flat.
on their back.
On the okay.
But as I know, a bit of yani değil mi? Erkeklerden know better. Some yes, some things put under the bed. Stay a bit of very young.
Okay.
They like on the side.
Was the right side of the person?
I am not about the right or left side biliyor musun arkadaşlar? Sol sağ var mı? Sağa doğru. I am not knowing it, but as I know, woman's a woman burying hole should be depth of
6 feet down.
yes. There is a standard depth because in the Islamic philosophy, the soul should be cover the breast. Okay, are you understand? Yeah, estimately the soul should be cover the breast because this is genital organs. Yani aynin yani ayakta durduğum kadar derin olmalı. Okay? My, for example, thumb should be like these levels. Okay? It's an interesting thing.
psychological model period. Psychologists suggest that acute grief often lasts 6 months to a year, when the emotions of loss can continue for much longer. The process of adjusting to life after a loss for 8 years, depending on the individual's coping ability and support system. Factors affecting mourning duration. Closeness to the deceased, e.g., losing a spouse or child may lead to prolonged mourning. Sudden versus expected loss. Unexpected deaths may lead to longer and more complicated grief. Cultural expectations and family traditions. While there are traditional timelines, mourning is highly personal. Some people may recover in months, while others take years. There is no right or wrong length of time to grieve.
Okay, nice story. I want a next. Son bir izlentiyle diye rahmet. Burası. Batuhan. Sercan geldi. Soy. Aylin. Bugün yoktu, tamam. Rüveyda. Neredesin Rüveyda? Olcay. İrem.
Buradayım.
Ünsal. Leyla. Osman. Evelyn. Isaac. Şölen. Zeynep. Balak. Gittin mi Zeynep? Evet. Nurdan buradaydı. Selin burada. Yine burada. Aleyna. Buradasın. İlayda. Kübra Taşdemir. Kübra. Kalimat. Amerika'nın buradaydı ama yok şimdi. Kristina burada mıydı? Buradaydı. Yok. Hayır, sanki. Fatima. Maria. Skip mi?
Hocam.
Anna?
Okay.
I'll be talking about the stages of grief. The stages of grief is denial, anger, then followed by bargaining, then depression and acceptance. And this stages was developed by Kubler-Ross. She was a psychiatrist. The first stage of grief is denial. Is that stage where there is the refusal to accept the loss. There's a possibility of shock and numbness. Refusal to accept the truth. It is temporary. Protects us from all the negative thoughts and consequences of tragedy. Denial gives us a bit room to breathe. When, especially when you just gotten the news of a close family or friend dying, that's shock of you like, no, it's not true, tell me the truth. So also I have a friend in Nigeria when she was told of death of her dad, she did not believe. She even said, like, she was laughing. She was like, no, it's not true. So that process also, give that time to breathe, to understand what is going on, that denial process. And then it goes also followed by anger, feeling of frustration and resentment, blaming others, or sometimes we also blame ourselves at this process, at this stage of grief. We blame ourselves as I've been there, as I've not been there. Sometimes we won't blame doctors, blame the nurses for not doing their jobs. Also, we also blame God, the point of blaming God, God, why He didn't allow for this to happen. At this point, at this stage, we are very vulnerable. Like, we are less vulnerable, we are very big, and then some people damage a lot of things. Some people damage their car. Some people do a lot of things, and then we have bargaining. In this process, I encountered a bargaining stage of grief. Um, the person, the person was, I think the person lost his mom, and he was like, okay, do you know what happened? He ordered they should bring his mom's corpse to a room. He prayed, prayed, prayed. He prayed to God, and God should rise his mom from the dead. He was praying throughout the whole day. He was praying to God for a miracle, but it didn't happen because of he was praying to God for bargaining. He was bargaining to God to help God rise his mom from the dead. It's an attempt to regain control and negotiate the reality of the loss. We try to seek outside solutions to somehow reverse the irreversible. The next stage is depression. When the loss, when we understand that this is what's happening in the bargaining part, when we bargain to God, maybe we pray to God, we bargain, we try to, make a miracle to happen. And then once you now understand that when the loss sink inside of it, that this is really happening, that is when depression comes in. Experiencing deep sadness and despair. Feeling of sadness, we often withdraw from others. Maybe you lock yourself in the room, you refuse to eat, you refuse to drink, you refuse to take your bath, you just stay away from people.
Guys, grief is by itself a depression. So, never ever a psychiatric uh, do a depression diagnosis to a person, okay? Because it is already a depression, right? And the right diagnosis about the depression occurs after morning, after 6 months. Okay. Uh-huh. Sometimes related to the morning or non-related. Okay. If you want to detect depression, you should interview this person almost yaklaşık almost 6 months after grief. Okay. Because it's nature of the grief already is a kind of depression. Okay.
Depression stage, that is when the maternal is the reality of the loss. And then, but sometimes depression, while going through depression, is also a stage where it can help us process the grief. It's when understand that this is what's happening. And then after depression, that's when healing begins. After your depression stage, that is when the healing begins. And then the last stage of grief is acceptance. Coming to terms with the loss. And acceptance, coming to terms with what happened, is also, that's when you honor memories. That's when life goes on. And then note, grieving, getting to acceptance doesn't mean it is over. Grieving is not a linear process. Individual may come back and forth between stages. It means that once you reach an acceptance stage, it doesn't mean that grieving is over. Sometimes it depends on an individual. Sometimes it goes back and forth, back and forth. Maybe after I've accepted the loss, I can still go back to bargaining. I can still be bargaining. I can still go back to anger. I can still go back to denial and also depression stage.
Yes, guys. I'd like to mention about an important thing. She said, mourning or grief isn't a linear process. Don't overthink it. No. Okay. What she wants to say? Right? What she wants to say?
It's like, it's not.
Okay. After your friends.
Okay, my understanding.
friends.
Okay, after my.
I will give you an answer, but I want to
Listen from your friends.
other friends sounds. Ne demek istedi? Now, in Turkish, I repeat the question. Dinlenmek bir süreç değildir dedi. Ne demek?
Bir süreç hocam.
Yani işte söylediği süreç yani öyle dinlemediniz mi?
I have a question for you.
Söyle.
Hocam
I have a
internette
question for you.
sabit İngilizce mi söylemiş, Türkçe mi söylemiş?
Yes, in English.
It's a simple question.
Said what said in linear is not a normal section. Is not about yes. Today it will be do it, and tomorrow it will be do it. It's not like that. Today maybe you're sad, tomorrow maybe you're normal. It's a dalgalı. It's not şey.
Belirli değil.
Doran
Changeable. Yes.
ya kusura bakma böyle telefonla ilgileniyordum ama neyi anlattı? Ya bak hemen yanındaki kişi konuşuyor. Yani bu kadar niye böylesiniz ben anlamıyorum arkadaşlar. Ben gerçekten. Baktan sıkıntısı olduğu zaman artık. Ülsa?
Ya Türkçe mi söyleyecek?
No, ben size söyleyeceklerini Türkçe söyleyeyim. Sergeant?
I understand, but I am not sure it's changeable. Emotions something.
Okay, please, Mercy, look at your
Okay,
slides.
yes. I explained the stages of grief, and then I started with denial, then anger, then bargaining, then depression and acceptance. Acceptance is the stage where you come to terms with your loss, you accept the loss and also try to move on. But that acceptance stage doesn't mean it's the last stage. Sometimes it is not linear. It goes back and forth. You can accept your loss, but at the same time, you can also switch back to your depression stage. You can also switch back to your anger stage. You can also switch back to your denial stage. It's not linear. It goes back and forth. You understand? Yes.
Isaac, what do you think about linear process? Please turn. This is the second time Mercy explained the linear process in the grief.
Denied.
It's still the linear process.
Okay, please continue.
I'll go back on. I should continue.
Continue.
Okay. Then this is a very important understanding of grief. Sometimes grief can be pathological. Pathological grief, also known as complicated grief or prolonged grief disorder, occurs when an individual experiences intense and persistent grief that disrupts their ability to function in daily life. Unlike typical grief, which is gradually improves over time, pathological grief is characterized by prolonged distress, emotional numbness, and difficulty moving forward, even after an extended period. Its pathological grief is a different type of, it's like an advanced or chronic type of grief. It takes hold of the person's mind and won't let go. It dominates their life, and often when you talk with that kind of person experiencing pathological grief, they usually explain they feel stuck. They can't move on. Like they feel stuck, like they can't continue their daily lives. They feel meaningless without that person. Often it usually occurs with spouses, especially when you this pathological grief usually happens to when you lose your spouse. Moving on is very hard. You will just feel stuck. You can't continue your life without that person. It usually occurs in loss of a spouse. And then and the causes, most of the causes of this pathological grief is also multiple traumas. Like you've lost not one person, not two person, not three person. It's usually too much overload of emotions to that person. So pathological grief usually happens to those kinds of individuals. And then I'll be talking about the types of pathological grief. And then we have chronic grief, like I said, it's a long-term, intense grief without improvement. It lasts beyond what is considered typical, often lasts months or even years without a decrease in emotional distress. For more than 6 months, but that person still feel pain. That person still go back and forth with stages of grief. After acceptance, you still go back to denial, you still go back to being angry, you still go back to being depressed. It doesn't change. It's just like a cycle of life. That person doesn't change at all. And then we have delayed grief. suppressed emotion that resurfaces later. This type of grief occurs is when someone doesn't fully express or process their grief right after a loss. Sometimes when if someone suddenly lost someone, they don't usually cry. You hardly see anybody cry. They will not cry. They just be there till after the burial or after a while. That's when the whole emotions will just pop out of nowhere. It's a delayed grief. And then we have exaggerated grief, severe emotional reaction, including self-destructive behavior. Uh, this part of grief is when you lose someone over time. I think this part of grief have to do with the anger stage of grief. It's it's overreaction. You get angry at people. You like that person's behavior change over time. That's angerness in that person. It's very bad. It also leads to self-destructive behavior, and this part of behavior also leads to substance abuse. The person will be very aggressiveness. The person will be very aggressive and all those negative kind of attitude. And then we talk about the masked grief, physical or behavioral symptoms that obscure underlying grief. This part of stage and type of pathological grief is when person's grief is not immediately apparent because they cope with it through avoidance or focusing on other issues. This masked grief is almost similar to exaggerated grief. Um, it's not apparent immediately after a loss. It just happens over time. Even when you just think about something, you just maybe cry. Some people cry, some people get angry and stuff like that. And also this particular type of grief, it also leads to substance abuse a lot because you're trying to cover your feelings. You don't know how to express your feelings. It's only by taking substance, only by avoiding to deal with that pain. You just prefer to, put that pain in taking drugs, in being angry, being rude, just being naughty and all that. And then these are the key features of pathological grief. The features you see in people that experience pathological grief. And then persistent longing for the deceased, extreme emotional distress, avoidance behavior, social withdrawal, preoccupation with death, physical symptoms, e.g. like chronic fatigue, sleep disturbance, severe impairment in daily life. And then it's when does grief become pathological? Pathological grief is typically diagnosed when the intense symptoms persists for more than 12 months in adults, 6 months in children, and significantly impacts the personal, emotional, social, and occupational well-being. And then symptoms include intense longing and preoccupation with deceased, severe emotional pain, difficulty resuming daily activities, feeling of emptiness and meaningless, and suicidal thoughts related to the loss. Yeah.
So I'm going to talk about nurses' responsibilities in the grieving process. So as a nurse, you should provide emotional support, maybe by compassionate presence, active listening to the person, and validating the patient's or family's emotions, and giving a safe space for the patients and families to express their feelings to you. And then you should assess grief and mental health needs, identify any signs of maybe depression or anxiety, monitor for risks of social isolation or previous mental health conditions, or maybe someone has or lack of like coping mechanisms, someone has learned to cope because they could easily endanger themselves. And then respecting culture and spiritual needs. Sometimes hospitals don't want to, maybe they say, oh, you're supposed to wrap the body in this certain cloth, and in the hospital it's like being mad about it. That's not how we should be as nurses. We should respect the culture and spiritual needs and understand and respect different cultures, perspectives on grief and mourning, and provide any spiritual care or support so that the person could do their own thing. so the person would carry on their rituals. And then facilitate communication by encouraging open and honest discussions about loss, help patients and families navigate difficult conversations about death, and bring the gap between the physicians and other healthcare providers, the patient. And then educating patients and families by informing them about the include the stages that Marcy had talked about and explain to them that you're going to go through this, you're going to go through that. Yeah. And then provide information on like support systems or grief counseling, support groups, so that they feel like they have a community with them and they don't feel like they're going through the grief process alone. And then nurses should also recognize their own emotional response to loss and seek emotional support when needed. And sometimes maybe you've also experienced loss as a nurse, and you don't know maybe how to deal with a person who has also lost someone. So as nurses, you should also recognize your own emotional response to loss and seek emotional support if needed. But also be careful and maintain professional boundaries. Don't get too close to the patient or they've lost someone, so I have to, like, no, you shouldn't do that. You should maintain professional boundaries, but also offer compassionate care. And then I'm going to talk about the articles. This is the first article. Sorry, I think into the heading, but the heading is trauma, loss, and grief for children in response to COVID-19. So this article is basically talking about how the children's lives were disrupted in COVID-19. They couldn't go to school, they couldn't like see their friends, and like they also like went they had to stay home, and like maybe some homes have domestic violence, and this is also like people say that grief is only about like maybe losing someone, but like also like a child going through domestic violence, they can't go to school and play with their friends, their whole life is feeling disrupted. That can cause some trauma in the children, and also maybe experiencing loss of like parents during the COVID-19 situation. And then same article. And then the second article is the title is the Integrated Process Model of Loss and Grief. This one is basically talking about that it's actually like I think you can search on Google and see it's short form is IPM, Integrated Process Model. So it has five dimensions of grief. Okay, it basically talks about the physical aspect, the emotional, cognitive, social, and spiritual aspects of grief. So the physical includes, of course, the body, and then the emotional, what comes with losing someone, distress, anger, guilt, and longing for the person. Then the cognitive is in the brain, thinking, maybe disbelief, and maybe awareness of that the person is not there. Then the social includes social withdrawal or support seeking, depending. And then the spiritual involves searching for meaning and reconstructive identity after loss. So basically, it provides holistic, existentially grounded model of grief that captures the different forms that I talked about. Yeah. And then the third article, the title is Ecological Grief, Religious Coping and Spiritual Crisis. So this article is not talking about loss of someone. You know, there are some people that also experience grief with climate change.
You say ecological grief?
Yes.
Okay. Can you explain it?
Yes,
Uh-huh.
there are some people that have they experience grief with like their environment changing, maybe trees drying out, maybe the sun being too hot and the grass is dying. I don't know if you guys have watched the series Pink Friends, and there's this character for her she experiences like she cries like how whole world is over because the Christmas trees have dried out and now they are throwing them or they are destroying that like the dried branches and everything. That's what ecological grief means, sadness from environmental change. And
I saw on Instagram a video that the baby girl was crying because of the leaf of trees in autumn was falling down. It's like that, right? It is very
Ecological.
they should be very sensitive people.
Okay. As I understand, the ecological change. Abnormal or normal? Abnormal changes in the climate. Except as I believe, right?
For some people,
Even the normal change can cause the grief in some people.
Normal change.
Yes.
Such as changes the
Season.
the season.
When seasonal
season,
change.
changes the season,
Yes.
except it as a kind of grief. Right?
Because it's a kind of grief in some people.
Even aside this, I was waiting to hear like finance for some people when they invest in a business and they lost their money, it can put them in grief as well.
Yes, financial
Loss. Yes.
looking for
Yes.
I mentioned it. Unemployment, yeah.
discrimination,
Yeah, miscarriage.
Unemployment.
can be after losing anything,
Anything
feeling
else.
sadness
Yes.
can be exact as a grief. Ecological grief looks interesting.
Yeah.
Let me say for the farmers aspect, maybe I'm rearing chickens, for example, and then maybe all of a sudden there's an outbreak of bird flu in the area where I rear my poultry, and then like birds, maybe I rear 1,000 birds, example, and then there's an outbreak of bird flu, and then all my chickens die. So it's also an example of ecological grief.
Yeah. Okay. Now, after global warming or after any disease, like these things, yes, I understand now.
Yes.
But Leila, you
I
in
think
your example, the normal process, right?
the normal process makes some people have a feeling of grief,
Yes,
like changing, like falling down the leaf of a tree in
The
autumn.
autumn.
They are very
Super normal.
they are just sensitive.
Sensitive. Interesting.
Very
Well,
interesting.
Yeah, so they're basically in this article they're basically talking about that it's also important to consider those things, not just the spiritual grief or I think like they should do more research on how people can cope with ecological grief, because most times we only know how they only tell us how to cope with like spiritual grief or religious grief or like the normal grief, but then they're also saying that in those ways that we can go through the normal grief, they should also do some research on how people can go through ecological grief. And then the last article is Death and Dying, understanding the African cultural lived context of death. So this article basically talking about the concept of death, the African perspective. Now, what I'm just going to talk about what struck me last time. They say that death before a certain age is unnatural and can be related to maybe invisible powers. Like if you just die,
Yeah,
let's say
sugar.
a child crying out of nowhere, not sick. They just they have said that oh,
Village people.
yeah, invisible force. And after that burial, sometimes they can actually avoid the graveyard. They fear to go there because they feel like, oh, what if it comes for me? Something like that. And then sometimes also if in that case, if that happens, and maybe one of the relatives says, oh, I can't go to bury this person, it's too painful, and maybe they go away. This article says that it can be seen as a sign of guilt, that maybe you're the one who bewitched that person to die. So they destroy your things, like your house, your everything without reason. They just say, okay,
That's why you have to learn very
guilty. So yeah, they destroy the person. And especially if there's no scientific explanation, or like if they are treating someone a disease, maybe you got like a disease and they are treating you, but you're not getting special
treatment.
And maybe you're on medication, but you're not improving. It's also seen as a sign of witchcraft. Like, why isn't the medicine working? Why? Yeah. So that's basically what this category is for. Okay. Nursing diagnosis related to psychiatry. Grieving is the first one, related to the loss of a loved one or a job, evidenced by social withdrawal, crying, guilt, anger, or despair. And then there's increased risk of prolonged or unresolved grief, like Nancy was talking about. It's related to maybe a history of mental health issues, depression or anxiety, and unexpected or violent ones. Maybe you didn't expect that, like a car accident, let's say, because you don't know if the person they were not sick before. That's what that's expected grief, unexpected death. And then ineffective coping mechanism related to inadequate support mechanism verbalized by the patient or poor decision making and problem solving. And then the interventions, establishing a psychic relationship by actively listening and providing a supportive environment, encourage expression of feelings by allowing the patient to talk about their judgment, encourage social support by connecting the patient with family, friends, or grief groups or grief counseling, like I said earlier. And then also teaching stress management techniques like deep breathing, meditation, or guided imagery. Provide emotional reassurance and validate their struggles. Respect and validate the emotions, the patient's emotions related to their spiritual distress. So in conclusion, grief and loss are deeply personal, yet universally experienced, and they impact every individual differently. How you go through grief is not how I'm going to go through, is not how someone else is going to go through. While the grieving process can be challenging, it is important to acknowledge emotions, seek support, and allow time for healing. Whether through personal reflection, community, or professional level, finding healthy ways to cope can lead to growth and resilience. Is it the video?
Go to Brazil.
Hocam adres şu bola yapıştırmanız gerekiyor.
It's hard when someone you know has died. You might cry and be overwhelmed by difficult emotions. It's hard when someone you know has died. You might cry and be overwhelmed by difficult emotions. Perhaps you feel angry or envious of others who are not bereaved. Sometimes things that people say to make you feel better can make you feel worse. It can feel like you're carrying a heavy weight. You may not want to eat much, and it can be difficult to sleep or concentrate. You may no longer enjoy the things you used to, or might believe you'll never be happy again. These feelings are normal, but this intensity of pain won't last forever. Grief can come in waves. One moment you're fine, and the next you can feel as sad as you did when the person died. It could be on the anniversary of their death, or if something unexpectedly triggers a memory. This is normal too. Because when someone has died, you don't just move on, and nor do you have to. In your own time, you can start to remember them in ways that comfort you, fit alongside other important things in your life. Your grief is unique, so do what's right for you, not what others expect. Grief isn't something you just get over. It will always be with you. With support, you can begin to rebuild your life and feel hopeful about the future again. For someone to talk to, call our helpline on 0800 02 888 40 or live chat via our website.
So you shared the post about the first one talks about the symptoms of complicated grief, which are numbness, detachment, or sadness over the death, inability to accept loved ones' death, intense sorrow and pain over the loved ones, loss of meaning or purpose in life, inability to enjoy life, carry out normal routines or recall pleasant memories. Spoke about this also in our presentation. And the second one tells us what to say and what not to say. Something like you must be relieved because the person is not suffering again. You don't have to say this kind of words. Instead, you can calm down the person. I'm so sorry how hard it has been over the last years. The person, for the person that is deceased. The other one, at least you or at least she. What happened is terrible. I know it will be hard for you for a long time, so I will keep on checking on you. These are the kind of words that will help someone who is in grief or who just lost somebody. Another word not to say is it's been a long time. Why are you still looking at the pictures? You don't have to judge the person. You have to understand that the person is going through a long process and help the person in it. The other one is let me know if you need anything. You don't have to say that. What you have to say is, I would like to offer you complete help. Your other son's birthday is coming up. Bring up ideas that can make the person happy. Don't just leave the person suspended. Like, if you need something, let me know and you could. You can bring up things that make the person happy. So now move on to our question. Okay, so the first question is,
Can you zoom it? Mm. Mm.
the first question is, which of the following is not a stage of grief according to Poplar's
See,
number two? What is anticipatory grief?
Oh God, there's something else. That last one. That's faithful.
Another idea?
Yeah, that not clear. I'm thinking B, but I'm not sure.
Anticipatory.
No, it should should be, I don't know. A is A correct? Atralos.
Next, which type of grief is experienced when a loss is not socially recognized, such as the death of a pet or an expert? Which type of grief
Grief
is experienced?
experience when loss is not socially recognized.
Yeah.
We shall be following the healthy coping mechanism. Should we see? How can a nurse best support a grieving patient?
How can a nurse best support a grieving patient?
C.
Thank you.
And we are mindset and empathy. Grief is a subjective thing. Which can't be cultures, person, and you mentioned about all parts of engagement, importance, and difficult issue. Thank you for your effort. Now, dear friends, all classes finished. Do you have any question for the second topics? No. Yes, as
Shall I
a seminar
Don't
in the CL about the working in Germany. If you want, you can attend the seminar, okay? It is around the 2 p.m. Okay? Thank you.
Okay. Oh, Oh, the bus has gone. Look at people coming. Where is the bus? Yes, oh, I'm impressed.
That's all, no. No, I think there's another. No, there's another one. The other one is empty. Hey, I'll try you. For real. So you didn't leave the first bus. Oh, really? Yeah. Airport every time when you get that age, they have to shout, "Slimmy!" Yeah. Alright. You run. Is it like you run? We haven't definitely you run. Why is the bus waiting?
Sabahın benim şey benim. Çok haksızlık yapıyorum. O açıdan dedim. Ama emek kesimde.
So let's that's what we are doing right?
Yani. Ya ama yine ben yaptım. Kaç mı yaşıyorlar? Ne yapıyorlar? İşte.
Yeah, that day. I'm on that day. Yeah, yeah. Fast food. Sin. Choice. Yeah, is it okay? Does she care about it? Care about it? Does she care about it? Care about it? That means that they said there's no. The other one I've been That's it. Hello. Yes, I'm stopping here. Thank you. Yeah, you. I'm in your department. I'm in your department. Yeah, I stopped at Sambaji. So I'm at the front side. Should I walk to the back? Okay, I'll follow your that corner. Where the entire department. Oh, la, la, la, la. That's when they do me again. My chef. They do me. No. So let's start. Let's start.
Well, no, it's good. You want to you know, say you know, come back, then you turn down to you.
Really?
You want to get to.
You can sign.
I don't sign now.
You want to go back to class?
Oh, the next sign on our group, and I do those 2 years normally now. So,
Understand? So now they're going to go school for you.
so they could deliver me my part. I go through.
Oh my God.
Oh, shit.
I'm a what?
I'm going to buy the book. For the book assignment.
I want peace. So, oh yeah, we don't have department.
Let's see. Yeah, I'm going to go ask. Oh, to go find small.
Person they are PP, then you go buy your book now. Mm. What's that? This? Tell me you have a school.
Go ask.
I'm not of not make you go buy. But if you actually go buy, we need to arrange our house. So,
And I won't take it there, but I still just
I think Wednesday when you get one.
Wednesday. It's nice now.
Um,
I go start, don't worry, I go do one TV because I know tomorrow.
Wednesday. One person who say no, they go anywhere. I beg go come up for road though. I know see my class people go hate me. You know, cause me, I just feel like boy, when you show a say answer question of answer. Yes, I don't know. Because like I get personal vendetta, but yes, so
Yeah.
there be theory for group now. If all their theory, they only follow us the talk. Now they're the course of study. I don't know that I get personal vendetta against their theory.
Yeah, the presenter you can't
Now ask a question.
No. Wow, the most just formulate what I think.
It's shame for the sham because now popular thing went for the
Don't be formulated it is them.
teacher can't they look there. But the teacher no normally your question you ask, teacher not the marker as this thing you dey get. Now just to see how well you know the course. That's why for the gang show. If I wear this thing what kind like this. But yeah, really answer that question very well. She's really educated. So. Precious. So let me answer it for you. Yes. I fear this thing when you say some taxi go say you the reverse them.
Yes,
Pass.
see.
You know it's me phantom pay. Yes.
If you ask me, okay, what's phantom pain? You say, this is a pain that usually occur, or you feel much pain, that pass adequacy.
No, but for our school, if they say if they ask you something especially related to health, and you not get idea, just tell them say you could research about and provide them with information. No.
When you talk something,
No, let me write it so if you don't know for head something.
no, but wait until I explain you say, you want to go say packaging,
But I wish you did not sing, This thing when I asked you, suppose what you talk as a normal.
Pain. See, I go use definition of pain.
Phantom pain means say, it means pain of loss. For example, person feel lost a leg, like the amputated leg, amputated arm. That arm not there again, no. The pain don't go, as in there don't cover.
Okay, the pain so you lost that.
Yes, you see they feel that pain. The thing with the shake. Like say you lost the hand, but not be physical, feel like cognitive kind of pain.
So meaning wait, now the pain say you don't lose the hand already,
no, like the nerve, they feel like feel say leg they there, or they just cut some, you they get.
Okay, like that pain.
Like that pain still there, the place go they shake, like it is very serious. It happen to
They hurt, like
it hurt them. They call a phantom pain, but not be any physical thing when they happen to you. If it be, for example, woman when get breast cancer, they already cut the breast years ago. But you see the woman still experience phantom pain. The pain of body loss, any part of the body. If it be ear, if it be teeth, if it be something like that. This thing now the doctor shows repeatedly.
I mean, the other thing now,
Repeatedly.
like, you don't tell me now this thing now.
Yeah.
Okay, I don't know.
From what we did, junior class up to now. I also see what you have explain about phantom pain and what if you do not care